Good morning, everyone. Today we are going to discuss about Vibrio cholera. It's a very important essay as well as short notes. So we all know that word called pandemic. So that is caused by coronavirus. Even the bacteria capable of producing pandemic that is evident or witnessed due to the Vibrio cholera. So we'll discuss each and every detail about the Vibrio cholera today. It is morphologically, it is a slender, gram-negative, curved bacilli. It is responsible for cholera. Basically, it is classified into, based on the salt requirement, it is being classified into one is so based on the salt requirement, it is being classified into halophilic vibrio and non-halophilic vibrio. Halophilic vibrio, nothing but if it is required more more amount of salt, which means salt lover. So that is called a halophilic vibrio. In the absence of salt, this bacteria not able to have a growth. So, example, Vibrio parahemolyticus, Vibrio alginolyticus, Vibrio vulnificus. Coming to the non-allophilic Vibrio, that is Vibrio cholera. It not require that much salt. These are the basic classification based on the salt requirement. In this picture, you can able to see the gram-negative, slender, curved bacilli, which is occur fish in stream appearance, how the fish move in the water. Coming to the next classification called Gardner-Wengertraman classification. So Gardner-Wengertraman has been put the Vibrio into two groups. One is Vibrio cholera, other than the Vibrio species. It is called the groups. Further, the Vibrio cholerae groups, further it has been divided into subgroups based on the somatic O antigens. Based on the somatic O antigen, it has been classified into O1, O139, other than non-O1 and O139, which means whatever antisera capable of agglutinating with O1, that is called O1. If the antisera of O139 agglutinated with species, that is O139. Apart from these two, which is not belonging to these two, it is categorized into non-O1, non-O139. More than 200 species has been identified. Coming to the next, further, it's subgroups of O1. Further, it has been classified into biotypes based on the biochemical properties, classical and LTAR. These classical and LTAR called biotypes of the Vibrio cholerae. The classical and LTAR of the Vibrio cholera, further it has been classified into based on the minor surface antigen characteristics. It's called serotypes. The Ogawa, Inaba, Ecojima. So these are the serotypes. Basically, Vibrio, from the groups to serotypes, it has been classified. Vibrio, Vibrio cholerae, and other Vibrio species. The Vibrio cholerae, further it has been divided into subgroups, O1, O139. This O1, O139, further it has been divided into biotypes called classical and LTAR based on the biochemical properties. The classical and LTAR of the biotypes, further it has been classified into minor surface antigen called serotypes called Ogawa, Inaba, Ecojima. So we have discussed two classification. One is based on the salt requirement. The another classification based on the Gardner and Wengertraman classification. Coming to the biotype which we have discussed, that is O1, further it has been classified into classical LTAR. So how it has been classified into beta hemolytes on the sheep blood agar, and chick erythrocyte agglutination, polymyxin B, group 4 phage susceptibility, LTAR phase 5 susceptibility, and August Foster test, cholera toxin G. So based on this property, the classical and LTAR has been differentiated. So coming to the positive point towards the classical, that polymix in B and group 4 phase susceptibility will be susceptible. And the cholera toxin, that is CTX1, will be responsible for the infections. In L-tar biotype, if you keep the strain into the sheep blood agar, you can get the beta hemolysis, whereas classical will not able to produce. Coming to the chick erythrocyte agglutination, if you take the chick erythrocyte, that is RBC, try to agglutinate with the Vibrio biotypes of Altar, you can get the agglutinations. And the Altar phase 5 susceptibility will be favoring towards the Altar. Vargas Prosker test, that is VP test, will be positive. The gene responsible for the Altar is CTX2. Coming to the pathogenesis. Here, mainly it is toxin-mediated infections. If there is no toxin in the food, there is no toxin produced by the bacteria, there is no role of infections. So it is mainly toxin-mediated. How we are getting infection? Especially the toxin containing bacteria contaminated with the food and water. So consumption, fecal-oral route, or ingestion of contaminated food and water. How much bacilli we need? At least 10 to the power of 8 bacilli should be present in the water and food so that it will capable of initiating the infections. What are the factors will promote the transmission? One is gastric acidity. For example, if the person not having the good adequate amount of acid, that is hypochlorhydria, the bacteria is acid labile. If it is crossing the stomach and reaching the intestine, need more number of bacteria so that it can capable of producing the infections. Crossing the protective layer of the mucus, it's one of the challenging factor. For example, in the small intestine, Vibrio will penetrate in the mucus layer. How it is possible? With the help of high motility, which is already bacteria has, then proteolytic enzyme, lectin, cholera lectin, mucinase. These are the factors will helps to penetrate the intestine of the human. The finally, once it is enter in the intestine, the adhesion factor called TCP, that is toxin co-regulated pile. This toxin co-regulated pile, which helps to binding the cholera toxin into the intestine. So we'll see this diagram. So we have the cholera toxin, which contains A and B unit. A unit is the active units, B unit is the binding units. So these units go and bind to the gangliosides receptor in the small intestines. So once it is bind, the B units bind, the A units automatically internalization takes place. It will enter inside the intestine epithelial cells. Once it is enter inside the epithelial cells of the small intestine, it is activating the G protein. Ribosylation takes place. Because of the ribosylation, the adenylate cyclase activated. Because of the activation of the adenylate cyclase, the ATP get activated, accumulation of the cyclic AMP. Accumulation of the cyclic AMP in turn will leads to outpouring of the chloride and sodium and water. So these are the main important things happening in the intestine. Because of this water, more number of waters outpouring, there is a loose stool in case of cholera. So let me again explain this procedure, principle mechanism. We have a cholera toxin. The cholera toxin bind to the intestine with the help of TCP. The TCP is there in the cholera. The A and B unit is there. B unit is a binding unit. A is the active units. Once the B units bind to the area, A unit start internalization takes place. Because of the internalization, the activation of the G protein, ribosylation takes place. Because of the ribosylation of the G protein, adenylated cyclase get activated. Because of that accumulation of the cyclic AMP. Because of the accumulation of cyclic AMP, there is outpouring of the chloride, sodium, and water in the lumen. Because of that, there is a loose stool and the patient will have the rice water in nature. Coming to the a little bit about the epidemiology, there is a sporadic case has been evident, epidemic, pandemic has been reported. Naturally, it is present in the coastal area, and the homeland is the delta region of the Gangas and Brahmaputra. And there is a first five pandemic happened, total seven pandemic. The first five pandemic happened in between the 1817 to 1923. All were caused by the classical biotype of the Vibrio cholera. So first six pandemic because of the classical biotypes only. The seventh pandemic differ from the sixth pandemic. One is it is started away from the India, that is Indonesia. First point. The second point, it's caused by LTAR and it is not that much severe, and but carrier rate is more higher. These are the points differentiating the previous six pandemics. Coming to the O1, that until now what we have discussed, O1, in the O1 classical and LTAR we have discussed. First six pandemic because of the classical, the seventh pandemic because of the LTAR. The O113 and another strain called Bengal strain. It is originated in Chennai 1992 and it is capsulated and invasive nature, and it is causing bacteremia and extra-intestinal manifestation, spread rapidly across the body as well as the all over the Asia. Usually it covers the 11 Asian countries. And in 1994, the fear has come down. The Bengal strain has been replaced by again the one LTAR become dominant. The clinical features less than 24 hours, the patient presented with diarrhea, that is rice water in nature, which is colorless, watery fluid with the flakes of mucus will be there. And sometimes if it is untreated, the patient end up with muscular cramps, renal failure, pulmonary edema, cardiac arrhythmia, paralytic ileus will have. Coming to the laboratory diagnosis, the first and foremost thing we should understand what is the sample you need. So what about watery stool or rice water stool? What is mean by rice water stool? How we once we wash the rice, how the color of the consistency of the water? It is similar like a Vibrio cholera infected patient will pass the stool. If there is no symptom, the patient rectal swab can be collected. And transport media, one is VR medium, that is Venkatrama Ramakrishna medium, Carrie Blair medium, autoclave sea water. These are the transport media are used to collection of the sample from the collection area to diagnostic area. The transport media which capable of, it is used mainly to maintain the viability of the organism. There is no multiplication of the organism will take place. Once you receive the sample, you have to go for the direct microscopic examination. You can go for the gram strain. In that, you can see that gram negative, curved, slender, slightly curved bacilli, which is fishing stream appearance. And you can go for the hanging drop motility also. In this hanging drop motility is mainly used to demonstrate the movement or motility of the bacteria. This is causing the darting type of motility, which is main hallmark of the Vibrio cholera. Coming to the culture, once you have done the direct microscopic examination, you can stick in the culture media. You can go for the enrichment broth, selective media, TCBS. The enrichment broth, nothing but You can, because there is a fecal sample, the fecal sample contain normal flora, which is inhibit the pathogenic flora. It will have some kind of destruction in the growth. So if you avoid that normal flora, you can get the wanted bacteria. So then in that case, you can go for the alkaline peptone water, Monshore taurocolorate tellurate peptone water. These are the main things you use to for the enrichment broth. What is enrichment broth? Enrichment broth, it's similar like a selective media, but it is a liquid media. And coming to the selective media, we have a alkaline bile salt agar, Monshore gelatin tellurate trypticase tellurate agar, TCBS agar, and Mekanki agar. So these are the selective media. In that alkaline bile salt agar, we have a translucent oil drop colonies. Monsoon gelatin taurocolate trypticase tellurate agar, we have a translucent colonies with a grayish black center and turbid halo will be seen. TCBS, you can get the yellow colonies. Mekanki agar, you have a translucent and pale colony. It is seen here. And once you have seen the culture, see here, this is a TCBS agar. You can get the yellow color colony because of the sucrose fermentation. You can get the yellow color colony. Here you can see the blood agar having the hemodigestion, not a hemolysis. It is deeper lysis of the RBC is called hemodigestion. And once you have done that, you can go for the culture smear. You can take the smear from this culture media and go for the gram stain as well as motility. You can go for it. Coming to the further identification, the picture shows that this is the string test. If you have to 0.5% deoxycholate, you have to emulsify in the culture media. Once you have emulsified, you try to take up the loop, you can get the string. So this is the lysis of the mucus. You can have the string test, which is positive for the Vibrio cholera. And second thing, you can get the catalase positive. The catalase, this is the you can see this is the bubbles. You can see in the slide test. This is the tube test. This is the oxidase. Positive will be blue color. Negative will be colorless. In this test, you can see the indole test will be positive. The ring, red color ring can be positive. And citrate will be blue color positive. Urease will be negative. TSI A by K. Acid by acid. How you have to read the TSI? First bud and key down in the slant by bud. In that way, you have to read it. Coming to the other further, if you want to speciate further, you want to group it, you can go for the zero grouping. You can already we have mentioned the Gardner Venkatraman classification. O1, if you O1 or O139, anti-sera of O1 or anti-sera of O139. If you add, you can get the agglutination. Based on that, if the O1 agglutinated with the sample, it is called O1 species. If it is agglutinating with O139, that is called O139. If it is not agglutinating with the both, it is called non-O1, non-O139. And serotyping also can be done based on the anti-serum of Ogawa, Inaba, and Ikojima. If you take an anti-serum for Ogawa, agglutination means Ogawa, Inaba. If it is agglutinating both, that is called Ikojima. Biotyping, already we have discussed that LTAR and classical can be classified based on the few property, that is beta hemolysis on the sheep blood. Second thing, chick or erythrocyte agglutination, polymyxin B, phase 4 and phase 5 susceptibility, cholera toxin, BP test. Based on this, we can able to differentiate the biotyping. Coming to the other method, how we can able to differentiate that based on the antigen detection. It is available like a cholera dipstick assay. Molecular methods also available by multiplex PCR, detecting the diarrheal pathogen. You can, based on the cholera, you can go for it. And if you want to do the antibiotic susceptibility test, you can go for the antibiotic susceptibility test as a routine test. So basically, you have to treat the carrier. For that, you have to identify the carrier by testing the water quality. You can go for the enrichment method and the filtration technique. You have to take a sample and put the sample into the enrichment media, place it in the incubator, and after 6 to 8 hours, place in the selective media. You can get the colonies. Second method called the filtration technique. Take the measure known amount of water, filter through the filter paper micropore membrane. Then you have to place it the culture media. You can count the colony. And this is the method by which they used to test the water. How you can able to prevent the cholera? First of all, you should understand the why the cholera has come. So the basically how we got the infection, contamination of the water and food. Okay, so we can drink hygienic water or boiled water, and hygiene is must. Second thing, parenteral vaccines are available by killed suspension of Vibrio cholera. It is available as a subcutaneous or intramuscular injection. Second, vaccines, that is oral vaccines. You can go for the killed oral vaccines are available, live vaccines are available. In case of children, you can get with the 3 doses, adult 2 doses. All the injection or all the oral dose should give the 1 week apart, maximum 6. So suppose if you give the first dose today, after 1 week, you have to give the second dose. We can extend up to 6 weeks, not more than that. The referral laboratory located in Kolkata, the name called National Reference Center for Cholera in India. What is the treatment? You have to treat the patient with the adequate ORS treatment. Oral rehydration solution you have to give. If it is required, you have to go for the antibacterial therapy. You have to choose the doxycycline or azithromycins. Coming to the, it's so far what we have discussed that Vibrio cholera. We have discussed that what is the classification based on the salt requirement. It has been classified into halophilic, non-halophilic Vibrio. And second thing, Gardner-Venkatraman classification we have discussed. And next, we put a little bit about epidemiology. We had a 7 pandemic, one is 6 pandemic because of the classical, and 7th one because of the Delta. Another one called O139, that is called Bengal strain. And after that, we have discussed the sample, what is the enrichment media, what is the transport media, what is the identification point we can say towards the Vibrio cholera. In the halophilic, non-halophilic Vibrio, the Vibrio mimicus also comes under non-halophilic Vibrio. It is because of the eating the seafood and especially oysters. It is self-limiting infections. Coming to the halophilic Vibrio, that is Vibrio required high requirement of the sodium chloride. At least 8%, 8 to 10% it is needed for its survival. In that group, parahemolyticus, alginolyticus, vulnificus has been grouped. Coming to the Vibrio parahemolyticus. So, little bit about the Vibrio parahemolyticus. It is capsulated and having the bipolar staining. It produces a peritrichous flagella. Okay. When it is produced a peritrichous flagella? When it is grown in the solid media. It is produced the polar flagella when it is present in the liquid media. Grows only in media containing sodium chloride, which already we have mentioned that up to 8% of salt it is required for its growth. In the TCBS, it is capable of producing green, not the yellow color, because it's not fermenting the sucrose. And sting test will be positive. Already I have mentioned what is sting test. 0.5% of sodium deoxycholate. If you add, it can get, if you try to lift the loop, you can get the string. That is the positive in both the case. How we can able to differentiate based on the biochemical properties. There are 3 antigen similar to Vibrio cholera. The one short notes they will be asked as a Kanagawa phenomena. Kanagawa phenomena nothing but if you inoculate the sample in the Wagatsma agar high salt containing blood agar. The normal agar, blood agar containing high salt. If you inoculate the sample, you can get the hemolysis. The hemolysis appears in the high salt blood agar called Kanagawa phenomena. It is seen only in the Vibrio parahemolyticus. This is about the Vibrio parahemolyticus. It is mainly causing the food poisoning and treatment self-limiting, and you can go for the doxycycline if it is not uh, controlled. Coming to the Vibrio alginolytica, it is similar like a parahemolyticus only, and you can see the infection in the eye and yes, wound also. The final one called Vibrio vulnificus. Vibrio vulnificus here, the VP will be negative, ferments lactose, not the sucrose. So the TCBS will have a green color colonies and it is capable of tolerate less than 8%. It causing the wound infection and septicemia occurs in the high mortality. So this is about the Vibrio vulnificus. So the last slide about the Aeromonas and Plesiomonas. Why we need to understand the Aeromonas and Plesiomonas? The Aeromonas and Plesiomonas similar to the Vibrio. Somehow it is different from the Vibrio because it is rarely associated with the diarrhea. And second thing, it is causing the pyogenic infections. Why it is been similar to the Vibrio? It is oxidase positive, polar flagella, gram negative. In this way, it is similar to the Vibrio cholera. This is about the Aeromonas and Plesiomonas. Coming to the end of the session, you should know diagnosis of this case. A 8-year-old boy developed severe watery diarrhea and vomiting for 2 days. Stool collected as a rice water with a mucus flake without blood. The specimen was subjected to gram staining, culture, and biochemical reactions. Agglutination with antisera. The antimicrobial susceptibility test is demonstrated with the zone of interpretation chart. Now, what is the clinical diagnosis and causative agent of this condition? So, based on the history, what is the clue given? One is watery diarrhea. And that too, it's mentioned that rice water with the mucus flakes without blood. Without blood means indicate that there is no dysentery history. So, rice water with the mucus means diarrhea case. We can exclude the possibility of the dysentery. And they have done the agglutination with the anti-sera. So, we have discussed that Gardner and Venkatraman classification. So, what is a probable diagnosis? It is a Vibrio cholera. Causative agent of this condition is, this is a cholera. Causative agent of this condition, Vibrio cholera. What is the virulence factor and its mechanism of action? Which we have discussed that. What is the mechanism, virulence factor? Because of the toxin. Cholera toxin either can be cholera toxin 1 and 2. If it is classical, 1. Delta, 2. And mechanism action, it's because of the toxin co-regulated pile, it is attached in the intestine and it enter into the intestinal epithelial cells because of the toxin binding B unit and A unit. B unit binds to that intestine epithelial cells and A unit internalization takes place. Once internalization happen, then activation of the G protein, ribosylation. After that, adenylyl cyclase will get activated. Because of the activation of the adenylyl cyclase, this cyclic AMP will be accumulated in the epithelial cells. Because of that, it is outpouring of the chloride and the water will take place. Because of that only, the patient gets the rice water with the mucus flakes. What are the various modality of the laboratory diagnosis? We have already discussed that on a sample, rice water stool. After that, direct microscope or culture. Direct microscope can see that gram negative, slender, and bacilli can be seen. And second thing, dotting motility can be seen. What is the culture media? You can go for the TCBS, blood agar, Mekanki agar, alkaline bile salt agar, everything it can be used and you can see the colonies. How will you treat this condition? Based on the symptoms. You have to go with the ORS. Okay. Then if it is not controlled, you can go for the antibiotics. That is either doxycycline, you can go and you can treat the patients. Okay, that is the important features of the Vibrio cholera. So now let's go for the questions. Tell me the selective media for Vibrio. Yes, this modified Thayer Martin medium, Robertson cooked meat medium, monitored salt agar not meant for the Vibrio cholera. TCB is the only option given here. O139 Bengal strain all are true. Okay, it's capsulated. It is toxigenic, clinically similar to the LTAR, more common than the LTAR. It's not more common to LTAR. It's less common. All of the following Vibrio species are halophilic, except, yes, only Vibrio as a non-halophilic. It is not required, Vibrio cholera is not required the salt. So this is about the Vibrio cholera, Vibrio, and these are my references. Thank you. If you have any doubt, you can ask.